of a client with a psychiatry emergency. Okay, so within this lesson, we have identified different psychiatry emergencies that a student nurse can be examined on, or someone who's doing clinical medicine, or whichever program that you're doing that has got psychiatry or mental health, okay, mental health topics. Okay, so the objective of this lesson is for you to identify, to explain, discuss, and describe some of the psychiatry emergencies that are there. So, the psychiatry emergencies that are there, we have suicidal attempt, okay, which can come as a psychiatry emergency. We have aggressive patients that may come to your health facility as a psychiatry emergency. We have depressed patients, okay, or patients suffering from depression that may come as a psychiatry emergency. We have a patient with alcohol intoxication that may come as a psychiatry emergency. Then we also have drug poisoning that may come as a mental health or a psychiatry emergency. We also have drug and substance abuse. So we have drug abuse or substance abuse that may come as a psychiatry agency. So these are the conditions that we want you to identify. These are the conditions that we want to discuss. These are the conditions that we wish to explain within this presentation. So after this lesson, you should not have a problem in identifying psychiatry emergencies because we have listed them for you. And you know, we have used a mnemonic. This is a dad who is very sad, okay? A dad who is very sad or sad dad, okay? That you cannot identify psychiatry emergency. So it makes me a very sad dad that you cannot identify psychiatry emergencies. So, nursing management of psychiatry emergencies. So, what are some of the psychiatry emergencies that are there? So, remember that failure to identify some of these psychiatry emergencies makes me a sad dad. Okay, so a sad dad here, it's a mnemonic for S, suicidal attempt, A, aggressive patients, D, depressed patients. Then the other D is for drug poisoning. Then the other A that is within that is alcohol intoxication. Then the next D is drug and substance abuse. So we have got two A's there. Okay, we have two A's and we have three D's. So if you want to remember it as just sad, you have to remember that we have two A's and three D's. So A to the power 3, okay, then D to the power A to the power 2 and D to the power 3 if you want to remember it as a third. Okay, so this is more of a mnemonic to remind you of psychiatry emergencies. Okay, in most examinations, you see that psychiatry emergencies will be one of those conditions that are examined on. So this lesson, okay, after this lesson, you should be well versed with knowledge that you require to know about psychiatry emergencies. Some of these conditions might have been covered in our earlier videos where we have looked at suicidal attempt, we have looked at aggression, okay, or depression as separate entity. But within this lesson, we just wanted to make it clear that we have psychiatry emergencies, and these psychiatry emergencies constitute these conditions. Okay, so the first psychiatry emergency is a suicidal attempt. Okay, by definition, when you say suicidal attempt, it's a failed suicide action. Okay, or failed suicide activity. So when you're looking at suicide attempt, you're just looking at a person who has survived the attempt for them to commit suicide, sui self. suicidal side to kill. Okay, so self-inflicted activity that may result in death, but they have failed to result in death. So a failed suicide attempt or a non-fatal suicide, okay, is what we can refer to as suicidal attempt. So a suicidal act that did not end in death is what we commonly refer to as a suicidal attempt. Okay, other authors may look at it as a suicidal gesture. Okay, so suicidal attempt, suicidal gesture, it just means the same. So with this distinction being that the goal of a suicide attempt is death of that individual that has survived is what we are looking at when we say suicidal attempt. Okay, so it is also important that you know that those who attempt to harm themselves, okay, who attempt to harm themselves as a group, okay, uh, quite from different of those who are actually die from suicide. Like we have females that attempt suicide much more frequently than males. Okay, but should be noted that small males tend to be successful in their suicide attempts, okay, or in their quest to take their own lives. Okay, so when we look at it in this way, there is another terminology that we can come across, that is parasuicide. Okay, so females are more likely to be admitted with parasuicide, okay, that is with suicide attempts, because other authors have used the term parasuicide to literally mean the same as, someone who has survived suicide. Okay, so females commit more parasuicides or are involved in more suicide attempts, but males tend to accomplish their suicide attempts. Okay, so as far as suicidal gestures and attempts are concerned, we are saying um, males tend to accomplish that, whilst the females, okay, tend to be admitted for suicide attempt or parasuicide. But regardless of the intention of the parasuicide, it must be treated seriously due to the risk of future suicide attempt by these individuals. In as much as we are saying females are more likely to be admitted with suicide attempt or parasuicide, it must be treated with the seriousness that it needs in order for it not to end in a death. Okay, so nearly half of all suicides are preceded by an attempt at suicide and does not end in a death. Those with history of such attempts, that is suicide attempts, are more significantly likely to, at some point, take their own lives. Okay, so when we use the term parasuicide, we are just referring it to suicide gestures or risk behaviors likely to result in death or unsuccessful suicide attempts. Okay, so you might interchangeably use the term parasuicide and suicide attempt to mean the same. Because in parasuicide, someone did something that may result in death. Okay, might or some in parasuicide, we're looking at someone who engaged in risk behavior that most likely would have resulted in death, but ended up at hospital admission as a suicidal attempt. Examples of suicidal gestures may include cutting, in which the cut is not deep enough to cause significant blood loss, or taking a non-lethal overdose of medication. This differs from self-harm in that in self-harm, the person's primary intention is to injure oneself. These gestures are typically done to alert others to the seriousness of suicidal persons' clinical depression and suicidal ideation, as they are usually treated as an actual suicide attempt by others, including hospital staff. Okay, so despite a suicidal person having no intention of dying, sometimes suicidal gestures may result in actual suicide or may result in death. Okay, so within this within this piece of information that we are giving out, we are saying there are many ways in which people try to take their lives. Okay, and it is not in each and every way that a person will decide to take that they may be successful with their suicide attempt. Okay, so in parasuicide, we are looking at a person that engages in these risk behaviors, not with intention that they'll kill themselves, but it may result in death. So, risk behaviors such as speeding or disregarding traffic laws or abusing drugs are considered parasuicidal. Okay, so when the person shows total disregard for whether his action or his action is just for fun and but eventually may result in death and the likes. So we look at that as parasuicidal behavior. So unsuccessful suicide attempts result from either miscalculation in the suicide plan, okay, intervention from hospitals, okay, people that are nearby, passers-by, will result in someone who had a risk behavior or parasuicidal behavior being saved. Okay, so intervention from others or hospitalization, we're saying, may result in someone who had engaged in risk behavior being saved. Okay, not that they intended to kill themselves, but they engaged themselves in these risk behaviors. Okay, and then a suicide attempt sometimes will come in because the person, whilst they were doing that risk behavior, they change their mind. Or in parasuicidal behavior, one change their mind, and then it then just result in what we call suicidal attempts. So people in suicidal attempts are at risk of completing their suicidal intention at some point. Okay, so why are we discussing suicidal attempt as a psychiatric emergency? We are discussing it as a psychiatric emergency because in the principles of an emergency, we are looking at airway being affected, breathing being affected, or circulation being affected. So if one decides to take their own lives, if they use drugs, they are going to have drug intoxication, or they will have what we call substance abuse, which we are discussing under psychiatry emergency. So the goal in substance abuse will be detoxification. But others try to take their lives by using a loop that is going to affect airway and eventually it will also affect the breathing. Okay, so that is why we are discussing suicidal attempts and parasuicide as a psychiatry emergency. Okay, we are discussing it for the simple reason that it affects airway, it may affect breathing, and also may affect circulation. Others attempt to commit suicide by using sharp objects, cutting themselves through so that they lose a lot of blood and eventually die. So that affects circulation. So if it is affecting circulation, then it can be considered as a psychiatry emergency, okay, or as a mental health emergency. So why we are looking at the suicidal attempt as a psychiatric emergency is because it may affect the ABC, okay, the ABC that are it's going to affect the ABC, okay, that is the airway, breathing, and circulation, of which it will need resuscitation. Okay, so resuscitation in this way will depend according to how the ABCs have been affected. Okay, so the next in line after after talking about suicidal attempt is aggression or aggressive patients. Okay, so aggressive patients may be admitted in hospital setup as a psychiatric emergency. Okay, so let us try to understand more what aggression is all about. Aggression arises from an innate drive or occurs as a result of defense mechanism, and it is manifested either by constructive or destructive act directed towards self or others. Aggressive people ignore the rights of other people. They must fight for their own interest and they expect the other person to do the same. Okay, so an aggressive approach to life may lead to physical or verbal violence. The aggressive behavior often covers a basic lack of self confidence. Aggressive people enhance to their self esteem by overpowering others and thereby proving their superiority. So people engage in aggressive behavior so that they establish superiority. To them, it's a self-defense, okay, mechanism, but they're also trying to promote their self-confidence at the expense of others. So aggressive people try to cover up their insecurities and vulnerabilities by acting aggressively. Okay, so when you're discussing aggression, there are two words that may come into place. Okay, the word anger and also the word aggression itself. Okay, anger is simply defined as a strong, uncomfortable emotional response to provocation that is unwanted and incongruent with one's values, beliefs, or rights. So, anger is different from aggression. Aggression, on the other hand, refers to behavior that is intended to cause harm or pain. Okay, so aggression can either be physical or verbal. Physical, where you're fighting someone; verbal, in terms of the language, vulgar language that the one is using. Okay, let us now also appreciate the characteristics of aggressive behavior. It is more like the clinical picture, the presentation of aggressive behavior. So, aggressive behavior is communicated verbally or non verbally by the choice of words, the tone of voice. So, all these are going to give a clinical picture or a picture of aggression. So aggressive behavior is communicated verbally or non-verbally. Okay, so non-verbally we are looking at gestures that are portrayed by an aggressor or aggressive patient. Then aggressive people may invade the personal space of others. They intrude in your social space, they intrude in your personal space. That is what aggressive people do. More like in a stance when one wants to fight the other person. They come into your personal space and eventually start pushing you around. So aggressive people may invade the personal space of others. Here, I just want you to imagine, people that wants to try to fight. You see the other one, who the aggressor mostly approaching the other and looking at the other person's eyes. They come so much into your personal space. Okay, there's personal space, there's social space, but they come so much too close to you. Okay, then the other characteristic of aggressive people is that they may speak loudly with a greater emphasis. Okay, they may speak on top of their voice to dominate the other person so that only them can be heard. So the other characteristic of aggressive behavior is that the aggressor tend to speak loudly with a greater emphasis. Then the other characteristic that can be seen with aggressive behavior is they usually maintain eye contact over a prolonged period of time so that the other person experiences it as an intrusive or as an intimidation. Okay, so the characteristic of aggressive behavior, one will just look at you, you get it, and they look at you at a long time so that you look the other way. So that's what aggressive people necessarily do. So they usually maintain eye contact for over a prolonged period of time. The other characteristic of aggressive behavior is that gestures may be emphatic and often seem threatening. Banging around the table, okay, with their fists, or if they are talking to you, it's like they want to poke your face with a finger. Okay, so they'll be stamping on the ground as they are speaking to you. So all those are some of the gestures that are that are portrayed by an aggressor, or those are aggressive behaviors. Okay, so when you talk about posture for aggressive behavior, it is elect. Okay, and often aggressive people, they will lean forward slightly towards the other person. Okay, they are trying to push themselves more into the personal space of the other, so they will lean forward, okay, towards the person. So the overall impression is one of power and the dominance. Okay, so these are characteristics of aggressive behavior. We can look at them in hospital setup as the clinical features of aggressive behavior. So aggressive behavior here can be expressed verbally, it can be expressed also non-verbally, because we have said aggression can either be physical or verbal. Okay, to do with a tone of voice that we are saying the aggressor or in aggressive behavior here, the voice becomes too loud. Okay, um, too loud in that you are with the person nearby you, but you are busy shouting. Okay, so you're shouting. So that is a sign of aggression or that's aggressive behavior. Okay, eye contact maintained over prolonged period of time. Okay, so that the other person can look the other way or may perceive it as intrusiveness. Gestures, emphatic, fist, or try to poke the other person's face. Posture is erect, like a dog that is about to fight another dog. So we have an erect tail, okay, sign of aggression. Of course, even when I give an example of dogs, I like dogs so much. Erecting the tail does not most of the time imply aggression, but I just use that one to for purpose of illustration. Okay, so types of aggression. Okay, types of aggression. Okay, you can remember them. That is IRH. If you are doing a diploma in nursing, there's what we topic. There's a subject IRH, that is integrated reproductive health. Okay, so these are types of aggression. Of course, this classification, others might have looked at it in a different way when you talk about Moyer's classification. Okay, so IRH is the mnemonic to remember the types of aggression. So there's instrumental aggression, there's hostile aggression, there is relational aggression. So when we say instrumental aggression, there are key elements that are coming out. So these key elements, I've tried to factor them in terms of a mnemonic as POS, like if you use a point of sale, okay, a point of sale place there, or SOP, or oops, you get it now? So those are some key elements or terms that should come out on what instrumental aggression is. Okay, so when I'm saying instrumental aggression, this is an aggression that is aimed at POS. It is aimed at obtaining an object, privilege, or space with no deliberate intent to harm another person. Instrumental aggression, the aim is at obtaining object, privilege, and space. So these are the terminologies or elements that we have put in the mnemonic POS or SOPs or OOPS. Okay, so you can start with space, you can start with privilege. It doesn't matter what you start with, but you need to explain that instrumental aggression, the aim is at obtaining POS. Okay, so that but what we are saying it is with no deliberate intent to harm others, but your target is the object, privilege, or the space, okay, to yourself. Then there is hostile aggression. Hostile aggression is intended to harm another person, such as hitting that person, kicking that person, or threatening to beat up the other person. So it is aimed at, that is HIK, hitting, kicking, or threatening to beat up another person. Okay, I look at the hostile aggression as one of the aggressions that we are very familiar with. Okay, that is hostile aggression. It happens most of the time in our everyday life that we have some people that would want to hit us, people that would want to kick us. Okay, if they have a black belt, of course they will try to kick us, and then we have people that will threaten some violence. Okay, a person of threat as a way of threatening to beat up another person. So that is what we call hostile aggression. Then there's relational aggression. Okay, relational aggression, some key terminologies. Okay, I've tried to simplify them and look at them as PS. Okay, so here we are looking at a form of hostile aggression that that does damage to another peer relation as a social exclusion or rumor spreading. Relational aggression, this is a form of aggression that is aimed to destroy a peer relation. It is a form of aggression whose aim is to bring about social exclusion. So, in rumor mongering, one may spread bad news about another person so that that other person is excluded. So, that is to do with the relational aggression. False rumors, bad things talking about the other person so that that other person faces social exclusion. So that is rational, or that is rational aggression. So types of aggression, we're saying instrumental aggression, hostile aggression, and relational aggression. Now, Moyer's classification has 7 types of aggression. In case you want to know more of these, you get it. We are saying MyFi tip. Okay, so we are giving you a MyFi tip as a mnemonic to remember Moyer's classification. Moyer, 1968, presented an early and influential classification of 7 different forms of aggression from a biological and evolution point of view. So, in my fight tip, we have the predatory aggression, we have the intermale aggression, we have the fear induced aggression, we have the irritable aggression, we have territorial aggression, we have maternal aggression, and we also have instrumental aggression. Remember, instrumental aggression, we have already tackled it. Okay, we have already tackled when we're looking at the gender classification of aggression. So, predatory aggression, that is attack on prey by a predator. Okay, so a predator, attack on prey by a predator, predators. So attack on prey by predators. This is we're looking at the lion and the impala. Okay, the lion being the predator, and then the impala being the prey. Okay, the prey for the lion. Okay, then we have intermale aggression. Intermale aggression. Okay, intermale aggression is a competition between males of the same species over access to resources such as females, dominance, and status quo. Okay, so there's a country that I've learned of where before a man has to marry or find a person that they will be with, they have to fight. The one who wins, of course, will get the woman. Okay, so that is an example of an intermale aggression. You might see it in animal kingdoms where the lion will kill the calves in order to dominate and promote ovulation, okay, and libido in the female lion so that it can be ready to mate. So here the male lion will kill the calves that it finds that it finds from the other marriage, okay, if I can call it a marriage with another lion, so it will kill that. So we see that dominance. Okay, so the intermale aggression is competition between males of same species, okay, to resources such as females and dominance and also status quo. Okay, so intermale more to do with females. But males, you need to have money. Okay, so when you have money, you have the females. Okay, so that's the thing. When you have resources, you have the females. Okay, when you have money, you gain dominance. So that is the intermale aggression necessarily that happens here in business. We have such things happening where the other business tries to dominate the other. So in intermale aggression, the things that we are looking at are to do with resources such as females, dominance, and status quo. Okay, then we have fear-induced aggression. This is aggression associated with attempts to flee from a threat. Okay, the aggression that you have because there's this fear uh, that has been provoked within you. So you have this aggression now, so that you can flee from from this uncomfortable situation. So fear-induced aggression is aggression associated with attempts to flee from threats. Okay, then we can now look at irritable aggression. Aggression induced by frustration and directed against an available target. Irritable aggression, it is induced by frustration. Okay, it's aggression that is coming because of your frustration. It can be directed against anything use that you start to kick because of displacement, okay, of your anger, displacement of your anger, and we define what anger is. So, aggression induced by frustration and directed against an available target, it can be an inanimate or animate animal thing. So, that is irritable aggression. Okay, so also another aggression which is common amongst the animal kingdom is the territorial aggression. Okay, so territorial aggression is a defense of a fixed area against intruders, typically conflicts. Okay, territorial aggression, you can see it between one country and another because of the issue of territory. So this is territorial aggression, defense of a fixed area against intruders, typically bringing about the conflicts. Then we have maternal aggression, most respectful, and I respect this maternal aggression. It's maternal aggression, a female's aggression to protect her offspring from a threat. Okay, we also have paternal aggression, of course. Okay, so maternal, that is a woman, then paternal, that is for the father, the male. Paternal aggression also exists. Okay, so the females, they have to protect their offspring. The males have to protect their offspring. So we have paternal aggression. Okay, then we have instrumental aggression, aggression directed towards obtaining some goal considered to be a learned response to a situation. Of course, this is in the words of Moya, of Moya 1968. Okay, looked at instrumental aggression as aggression directed towards obtaining obtaining some goal considered to be a learned response to aggression. So these are the types of aggression that we are looking at under Moya, and then we have looked at general types of aggression. You may ask, why are we discussing aggression? Okay, why are we discussing aggression as a mental health emergency? Okay, aggression is discussed under mental health emergency because of risk to self and others. This aggression, patient may either kill themselves or may either harm or kill the people that are trying to care for them. So restraining becomes very, very important for such patients. Okay, with the aggression. So in aggression here, there is no airway which is affected. There might be no breathing which is affected. There might be no circulation which is affected. But aggressive behavior of cutting self, aggressive behavior of stabbing others and the likes calls for concern that you need to stabilize the patient. So behavioral skills, behavior modification skills comes in order to stabilize the patient. Okay, so that is why it becomes a mental health emergency or psychiatry health emergency because of the risk of harm that is there. Okay, so having looked at aggression, okay, and defined some terms like anger, aggression itself, looked at the characteristics of aggression, it is now time to look at another type of mental health emergency. Okay, so the other type of mental health emergency that we are going to look at is the depression or depressed patients. Depression is a state of low mood and aversion to activity that can affect a person's thoughts, behavior, feelings, and sense of well being. Depressed people may feel sad, anxious, empty, hopeless, worried, helpless, worthless, guilty, irritable. They may feel hate, they may feel restless. Okay, so by definition, depression is a state of low mood and aversion to activities. Okay, within the environment. But we are saying depressed people may have this significant clinical presentation of hopelessness, anxiety, extreme sadness, look worried, helpless, okay, and look guilty. Okay, so now what are some of the causes of depression? So the causes of depression may include life events, may include some medical treatments, may also include some non-psychiatric illnesses, may also include psychiatric syndromes that may lead to depression. Okay, so that is about it. Some of those things that may bring about depression. Okay, so remember, when you're looking at the causes in psychiatry, we look at the biosocial and psychological causes, biological causes, psychological causes, okay, and also look at the physical causes of a mental illness. So here we have looked at specific causes to do with life events, medical treatment, non-psychiatric illness, and psychiatry syndromes. So now let us discuss further what we mean when we say some of the causes of predisposition to depression may include life events. Life events and changes that may precipitate depressed mood include childbirth, menopause, financial difficulties, job problems, loss of a loved ones, can be family member or friend, natural disasters such as earthquakes, hurricanes, tornadoes, okay, or having relationship troubles, separation, divorce, bereavement, or other catastrophic injuries may, as life events here, may predispose to depression, may cause depression, or may predispose to an episode of depression. So, looking at any of these things that have happened and how the patient presents himself, it may be considered as a psychiatry emergency. Okay, as a person will stop eating, okay, and when they stop eating, okay, it's because they feel worthless, they feel helpless, okay, in the depressed mood, and they may become mute. Okay, so if they become mute now, you don't know what necessarily to do for the patient. They become withdrawn. So you understand that they may need urgent care. Then there are some medical treatments that predisposes to depression. Okay, so on this one, we can say certain medications are known to cause depressed mood in a significant number of patients. These include hepatitis C drug therapy and some drugs used to treat high blood pressure, such as beta blockers or lezapine. Okay, so these drugs may predispose to someone being depressed. Okay, so the hepatitis C is used in hepatitis C. Okay, then rezapine drug or beta blockers there, they may predispose one to having a depressive episode. Okay, there are also non-psychiatric illnesses that predispose to depression. Depressed mood can be as a result of a number of infectious diseases, neurological conditions, and physiological problems, including hypoandrogenism. Okay, androgen, the root androgen to do with male. So hypoandrogenism in men, then Addison's disease, Lyme's disease, multiple sclerosis, chronic pain, stroke, diabetes, cancer, sleep apnea, and disturbed circadian rhythm may predispose one to having depression. Okay, it is also often one of the early symptoms of hypothyroidism. If someone has got hypothyroidism, you might start seeing them coming in depressed mood, and you don't you if you do not understand hypothyroidism very well, then you would not identify this. Okay, so there might be an underlying condition that is bringing about depression, so it's better to do the test to do with thyroid hormones there so that you rule out this, okay, this condition. But you also need to know that there are also non-psychiatric conditions that can cause depressive mood, okay, that we can still talk about. But here we have just talked about hypoandrogenism, and we can talk about hypothyroidism, Lyme's disease, Addison disease, multiple sclerosis, as predisposition or diseases that may predispose to predispose to depression. Okay, so now other conditions that may lead to psychiatric syndromes includes A number of psychiatric syndromes feature depressed mood as a main symptom. Okay, so those that feature depressed mood as main symptoms are a lot. So the mood disorders are a group of disorders considered to be primary disturbance of mood. These may include major depressive disorders, commonly called major depression or clinical depression, where a person has at least 2 weeks of depressed mood or a loss of interest or pleasure in nearly all activities. Okay, so other conditions here that we can still look at are chronically depressed moods, where a person, the symptoms of which do not meet the severity of major depression, but a person has some chronically depressed mood. Another mood disorder, like bipolar disorder, okay, feature one or more episodes of abnormally elevated mood, then the problem with cognition, problem with energy levels, but may also involve one or more episodes of depression or depressive episodes. When the course of depressive episodes follows a seasonal pattern, the disorder, the disorder may be described as a seasonal affective disorder. Outside the mood disorders, we can have borderline personality disorder, which commonly feature depressive or depressed mood. Then we have adjustment disorder with a depressed mood, okay, or depressed or mood disturbances, okay, in which resulting emotional or behavioral symptoms are, are significant but do not meet the criteria for major depressive disorder. Okay, and then other syndromes that may predispose to depression is post-traumatic stress disorder. So this may predispose to depression, and the patient and also anxiety disorder may predispose one to having a depression or having a depressed mood. So now, having looked at these many predisposition to to depression, it is important to appreciate that if any of these, okay, results that a patient comes to the hospital, they may be looked at as an emergency because it may progressively affect the patient, and at the time when they need to take action, it might be too critical for the patient. Hence, as they come to the hospital at this point or at this moment, then it may constitute a psychiatry emergency. Remember also that depression predisposes one to suicidal ideation and the likelihood of uh, engaging in suicidal attempts. So, one who is depressed should not remain alone, or else they may decide to take their lives. So, that is why this depression is looked at as a psychiatry emergency, okay, because of the risk of the person taking their own lives. There might be no problems with airway, there might not be no problems with breathing, there might be no problems with circulation, but there is high risk of this person taking their own lives. Okay, so that high risk of one taking their own lives then makes depression a psychiatry emergency. But we have to consider the condition or the underlying factors that might have led to the condition. Okay, so in this first part of our presentation, we have looked at three conditions that are considered psychiatry emergencies. So the three conditions that are considered a psychiatry emergency include a suicide attempt, and we have defined the suicide attempt within this discussion as a failed suicide behavior or a failed suicide activity by the survivor or the person that wants to commit suicide. So, sui self-side killing. So, person to kill themselves. So we defined as suicide, okay, and then also looked at the parasuicide, okay, which mostly constitutes risky behavior with no intention of taking, or with no intention of one taking their lives, but may end up as a suicidal attempt, within the hospital. Okay, so risk behavior can be, when someone is pumped with a lot of endorphin, or pumped up with a lot of excitement, they may decide to do certain risk behaviors or engage in certain risk behaviors that may be termed parasuicidal. So when you engage in those items that might be considered parasuicidal, or these are risky behaviors, you find that people that are nearby may save or resuscitate you. So when they save and resuscitate you, because of that risk of you killing yourself by engaging in that behavior, we are looking at it as a psychiatric emergency because of the potential that it has to affect airway, breathing, and circulation. So, suicide attempt comes in as a psychiatric emergency because of the risk of drug abuse, depending on the route that the person takes to take their lives. So, if they use the drugs, then there is the issue of drug abuse or substance abuse. Okay, then after suicidal attempt, we went on to look at aggression, okay, as one of the psychiatric emergencies. So in the aggression, we're saying it is a psychiatric emergency because the patient has either risk of self-harm or there is the risk of harm to others. We're looking at a person who is aggressive, can engage in a fight, even when they cannot win that fight. So they can be beaten to death without the other person realizing that actually it's a mental illness or it's a problem that needs cognitive therapy so that the patient can recover. So when looking at aggressive patients here, we then tabulated some classification of aggression. Okay, so some classification of aggression, looked at characteristics of aggression. We looked at Moyer's classification of aggression, and we simplified Moyer's classification in MyFi tip. Okay, then the other general types of aggression we simplified it in one of the common subject IRH to mean instrumental aggression, hostile aggression, and relational aggression. Okay, it's important that when you are defining any term, okay, within academic circles, you consider the elements that makes the complete meaning of that phrase or term that you are trying to define. So we looked at aggression and those 7 types of aggression. So from here, you can see that we have given you a lot of types of aggression. Then depressed patients. Okay, depression comes in as a psychiatric emergency because there is a risk of patient committing suicide or patient taking their own lives. But we are saying this is a depressed patient is a patient that he may feel anxious, sad, irritable. Okay, they feel hate, they are restless, they are worried. Okay, they are worried sick. Then the causes of depression or the predisposition to depression can be categorized in terms of life events. Okay, it can be categorized in so life events falls under social. Okay, social predisposition to depression. Then we have medical treatment that is to do with the drugs. Okay, and we gave an example of beta blockers like rezapine, increasing the chances or the risk of one suffering from depression. Then we talked about diseases or non-psychiatric illnesses like thyrotoxicosis, okay, diabetes, cancer, sleep apnea, as some of the conditions that may predispose one to depression. Then we looked at psychiatric syndromes, okay, like depressive disorders that are there. Okay, we looked at other syndromes that are there, like bipolar disorders. Okay, bipolar disorders are some of the conditions that may predispose one to suffering from depression. Okay, so major depressive disorder that we mentioned here, predisposing one to depression and other conditions. And there are also non-psychiatric conditions and also psychiatric condition in which depression may come in as a condition of concern. So today, these are the things that we are looking at, and I would want you to remember that when looking at psychiatry emergence, we have suicidal attempt, we have aggression, and we have depressed patient. Of course, this is for the first part of our presentation. In our second part of the presentation, we are going to look at drug poisoning, we're going to look at alcohol intoxication, and we're also going to look at drug and substance abuse as some of the psychiatric emergencies. So for this presentation, we were just looking at SADS as some of the conditions that predisposes to psychiatric conditions. Okay, so from me, I'm saying please keep studying,